HIV stigma is negative beliefs and attitudes about people living with HIV. Many people with HIV experience stigma at some point in their lives. If this is happening to you, you're not alone.
Stigma often stems from a lack of understanding about the reality of HIV. People living with HIV experience stigma in different ways. For instance, internalized stigma, which can be stigma via the self, where people feel that they will be discriminated against because of their HIV status, which can often lead to feelings of isolation, of shame, of guilt, and all those negative feelings. But people living with HIV also experience stigma in society in general, but also in services. So for instance, they can be discriminated against because of their HIV status in healthcare, in the workforce, and sometimes people living with HIV experience stigma from family and friends.
Studies have shown that people living with HIV are more likely to experience depression, anxiety, and other forms of mental health issues. This is particularly true for women living with HIV, who regularly face intersecting forms of stigma and often have so many pressures in their lives.
Stigma also prevents people from testing for HIV and other STIs. It can prevent people from talking about HIV, and it can prevent people from telling significant others about their HIV status. However, you don't need to put up with stigma. There are a number of things that you can do in order to address it. What you can do is to arm yourself with the knowledge, the will, and the power to kick stigma out of your life. These are some of the things that you can do.
One thing that's helpful in tackling stigma is getting up to date with information about the reality of HIV today. Know that people living with HIV cannot pass HIV onto their sexual partners if they have an undetectable viral load, also known as U equals U. It's important to know that women with HIV can have children born free of HIV, do any job that they like, and live a long and fulfilling life.
You can also get peer support. Speak to other women living with HIV who may have experienced stigma and ask them to tell you how they coped with it. Remember, if you tell somebody that you have HIV and they don't want to be with you, ask yourself these questions. Do they pay your rent? Do they pay your bills? Do they feed your children if you've got some? And if they don't, then you really don't need them in your life. It's always better to have one or two good friends who support you than many who don't.
Sometimes it may be helpful to seek professional help. Speak to your HIV clinic about your mental health. They might be able to refer you to see a psychologist. You can also go and speak to your GP, who should be able to refer you for counselling in the area in which you live.
And remember, sometimes if you experience stigma, it's not about you, it's about the other person. You are worthy.
If you experience stigma in workplace settings, know that it's illegal to discriminate against people because of their HIV status. Know your rights. The National AIDS Trust has some very useful pieces of information. If you experience stigma in a healthcare setting, complain, speak up. And if you're not happy with the care that you're getting, go somewhere else so you can get the treatment and care you deserve.
And also make time for your emotional well-being. Remember to get into nature, do some mindfulness, and positive self-affirmations also help. You can say things like, I am worthy.
I believe in myself.
I deserve to thrive.
I deserve to be happy.
I can do this.
I'm beautiful.
And if you do experience stigma from other people, remember it's not about you, it's about them. You've got this.